Mrs. Luca.
Yes, doctor.
Okay, so have you been diagnosed with diabetes before?
Diabetes, God forbid. No. That's not run in my family.
No one.
My husband is the one, that has diabetes, but not me.
So you were never told by any physician that you have diabetes mellitus? Do you find that you're hungry all the time?
I'm hungry right now. I need food. Food. Wait. When was the last time I ate? Since I came here, people have not given me not even a tray of food. See what people have been giving me. Drink. I drink. What is it? I need real food. Apple, eba, pepper soup. Do they have that around here? Nkwabi.
We'll take care of you.
Please send me. I see this logo. I don't know what food they have. Send your caterer in.
Do you pee at night? Do you find yourself peeing at night?
You?
How often?
I drink about 4 to 6 times.
You know, you were pretty sick when we brought you in here. You had an acute state. You were in an acute state. Your blood glucose was very low. It's a condition we call hyperglycemic state.
Yeah, I know why that happened. It's because my husband is not been feeling well, and I have not been eating because it's been affecting me. So it's very normal.
You know, HHS is a life-threatening condition.
Oh boy.
It has a very high mortality rate. And I want you to know the severity of what happened to you when you came here.
Okay.
And based on our lab results, your A1C shows that you have had pre-existing diabetes, undiagnosed diabetes.
What happened to me yesterday? My husband is not feeling well, so it's affecting me, and I've not been eating as much. Now I've been fasting so that he'll get better, but my temperature dropped, my blood sugar dropped. That's why. It's not any diabetes. You need to look well. Maybe those people you hire working for you, they're not doing a good job. Let them know. Look at it again.
Do you find yourself hungry all the time?
Mm-hmm.
You're hungry?
Because food. I got married early because of food.
You wake up at night to pee?
Mm-hmm. Because I drink a lot.
How often?
Maybe about 4 to 6 times.
4 to 6 times?
Yes, but that's explainable. Because the temperature, our environment is very humid, it's hot. So I drink a lot and I pee a lot. It's like check and balance,
So you pee a lot as well?
Because I keep drinking and I keep peeing. So it makes sense. Don't you think so?
Well, most people diagnosed with diabetes go undiagnosed and get diagnosed during an acute phase that happens suddenly, just like your case.
Give me food,
So that's why I wanted to have a conversation with you.
Okay.
So you can know how serious your condition is.
Okay.
About 6.7 million people suffer from diabetes globally.
So I'm in that million now. I need food to feed my baby. Can't you see how beautiful I look? You like this? And I recently got my butt done. So I need food to feed it. See how I'm looking, in all the right places. I
want you to know how serious your condition is.
I'm fine. There's nothing wrong with me.
We'll fix you, get you something to eat.
Okay.
But I wanted to have a chat with you so you can understand the extent of damage that diabetes can do or can have on your body organs and your system.
Okay.
And I want you to give us a chance to treat you, send you home with medications, and I would like you to be compliant with your medical regimen once we start your therapy.
Okay.
I would like to send the nurse to ask you some more triage questions. I will take it from there.
You need to go and say what I like.
What do you like?
Ikebe soup, no? Front and back. Yes, nah. Just find somebody to make me happy. That's all.
Well, they definitely look cute. But
you can say that again.
We have to focus on getting you treated for your condition. Okay.
All right, doctor. Just make it quick. Send somebody. I need food.
Okay, I'm going to talk to you later, Mrs. Ndeka.
Okay.
Thank you for speaking with me today.
Send the caterer. I need food. All right. Thank you, doctor.
Hello. I'll be a nurse today.
Hi, how are you?
I'm good. How are you doing today? Can I confirm your date of birth and your name, please?
Mrs. Induka, 1052.
Okay, and how are you feeling this morning?
I'm feeling okay. It's just that I'm hungry. I've been waiting for my food. Yeah. I don't know what the hold up is.
I'm just going to ask you a couple of questions, okay? Okay. Can you give me a brief history of what you eat on a daily basis?
Hey, this man wants to tempt me. In the morning I eat a full loaf of bread, agege bread, if you know what it means, fresh from the oven.
Okay.
When you squeeze it up, oh my god, it's so good. Then in the afternoon, I pretty much will eat my bread, because I love it so much, it's good. Or I do that, I eat that, and I take a little bit, booze with it, just drink and eat the bread. Then at night or maybe in the evening we can eat pepper soup, bushmeat pepper soup, isiokwu. And then we can go with swallow at night, or either pounded yam or apple, depending on the soup available. Yeah, we influence the choice of swallow. And then we can do jollof rice or rice and stew.
Just to ask the other question, do you drink alcohol, soda, juice, any?
No. I drink vodka.
You drink vodka.
Vodka, look at me. You like what you see, right?
Oh, that's good.
Well enhanced and down. See, you like my BBL. I'm a society woman. So there's always parties, gatherings. There's always, functions going on to attend. Oh, my girls miss me. I need to go home. So we can drink, stouts, Guinness, Star, depending on what it is, mix and match.
Yeah.
Just, those are my kind of, drink.
So you like to drink a lot?
Oh, yeah.
Okay. Every day?
Yeah.
Is it every day or just occasionally?
Yeah. I'm a society woman. Can you see how endowed I am? You see taking a look at my BP.
I see.
So I'm a society woman. We hold conferences, meetings, parties, gatherings, almost all the time. So there's vodka, there's margarita, Guinness, stout, beer. Occasionally I can mix, cocktail, mix and match. Yeah, that's like all the time. The girls are really missing me. Yeah.
Right. Well, Mrs. Sunduka, from what we have taken together, your weight is 228, your height is 5'6", and based on that, we have a BMI of 40.
I am too now, so it's evident.
Okay, and your A1C is 8.3 and your abdominal growth is 42.
What is abdominal? This one? I already have surgery booked in Brazil, so that I can go and do tummy tuck, because I've had this, my beautiful beatings here. Then I have this one too done. So I need to go and do, my doctor's in Brazil, tummy tuck, so that I can look like, our shape. Coca-Cola. Hey! I need to hook you up. You need to come, let's nice you up. Let's do touch up for you, baby. Oh my god.
Well, that would be all from me today, okay?
Okay.
And you do what?
My food.
Your food. I'll let the chef know about it and I will speak to Dr. Rice, okay?
Alright.
Thank you.
Okay.
Mrs. Sunduka, I felt that it's important I talk to you a little more about your diagnosis. How do you feel today?
I feel good. It's just my food. I'm still hungry. I haven't seen anybody.
Okay, your food is coming.
Okay.
I have informed the dietary department and your food will be here soon.
Okay.
But I wanted to talk to you a little more about your diagnosis. I feel that you don't quite understand the depth and the need to take medications, and you don't even believe that you are diagnosed, you are diabetic. Now, I want you to know that some ethnicities or races are prone to diabetes mellitus, and this includes people of color, blacks, African Americans, Hispanic people, people that are overweight, obese, people that don't exercise. They are all prone to diabetes, including, individuals that have a family history of diabetes. They are prone to diabetes. Okay, so it's important. I explain to you the the need and the urgency to begin treatment for type 2 diabetes.
But I feel fine.
That's the thing.
I feel fine.
That's the
I
thing.
don't feel, it's just the food I'm waiting for. I'm hungry.
So I want you to know the extent. Yes, you like food, but I want you to make better choices when it gets to food.
So are you saying I should stop eating my apple, fufu, even bushmeat, pepper soup, to stop eating them?
Well, I will be sending you home on a cardiac diet. Okay, a cardiac diet. I want to also send you on a diabetic diet.
How am I supposed to do that? So that means I should stop eating apple, my fufu, my nkwabi, my isiewu. I should stop eating all those things. So how am I going to survive?
Well, it's not only about what you eat. We need to talk about your portions and how often you eat the food. So those are the things that, and I will also refer you to a dietitian to help you with the goal of transiting into making better health choices.
As long as the service is, that's fine.
Some other things I would like to talk to you about is, your weight. Okay, you are quite overweight. I'm sure the nurse had reviewed your weight with you. Your BMI is elevated, it's very high. Okay.
Which is what I have a question.
What is your question?
The nurse mentioned BMI. You are coming in here, BMI, AVD, what is BMI? What am I supposed to do?
A normal BMI is 18.5. Okay, and it's going to be less than 25. So 18.5 to 24.9. That's considered a normal BMI. Now, anything above 24.9 is considered overweight. So if your BMI falls within the category of 24.9 and above, that means 25. Okay, once your BMI is 25 and above, that's 25 to 29.9, you are considered overweight. You are not obese at that point.
Okay, so now I have my BBL in my tummy talk schedule. By the time I do it, and you need to solve the problem.
People or individuals with BMIs ranging from the 30 to 34.9 are considered class 1 obesity, but you fall into class 2 obesity based on your BMI. Now, class 2 obesity is BMI 35 to 39.9, and that's where you fall. So it's actually urgent. We need to get you to a healthy weight, healthy lifestyle, healthy diet, teach you about portions, better, healthier options for you, because not all these are healthy for you. So it's not only about what you eat, it's the quantity and the quality, high quality food, and incorporating vegetables, fruits into your diet. Okay.
Okay, doctor. So, I need to eat first.
Mrs. Sunduka, before I leave here, I'm very worried about you, but I would like you to take advantage of what we can offer at Bridges Medical Center.
Okay.
We have advanced diagnostic imaging. We are able to provide to you advanced monitoring systems. We also have a state-art facility for surgery, surgical center.
Do I now need surgery?
Not you, but if you have yourself, that God forbid you have an emergency need for surgery, we have state-art, surgical facility here, and also comprehensive lab monitoring. I would like you to make sure you take advantage of these services that we can provide before you leave here. Make sure you check your sugar every day. Okay? We'll give you the intervals in which you need to check your blood sugar while you are home, when you are discharged, the frequency when you're supposed to check it before you eat and after you eat. And we want you to come, make sure you comply with regular checkups at the facility. Okay, so I will see you in your next appointment. I want you to think about compliance before I leave here, before you leave here today. And we'll see you in a few weeks. The dietary department will bring your food in a few minutes.
Okay. All right.
Jesus. See who we have here. Mrs.
Doctor.
Nduka, how are you today?
I'm doing well, thank you.
Good. I wanted to know if when I discharged you last week, I did request that you take your a record of your blood glucose before meals, after meals, and at bedtime. That record will help us know if the medication is effective. It will also help us know if we need to titrate your medication or we need to change your medication. So I want to know how you're doing. Do you have a record of that?
Oh yeah, I have something drawn up for you. I have something written up for you. Yeah.
BBL, tummy talk,
The Brazilian type.
Brazilian tummy talk, BBA.
And then I want to do a Brazilian breast augmentation. I want to increase the size of
So
this.
there is a complete disconnect. You don't understand your diagnosis, your prognosis, and the complications that comes with diabetes. Yes, you want to have a BBL, you want to have BTT and BBA, whichever one it is. But madam, you are very sick. You have a chronic illness called diabetes mellitus type 2. You've got to take your medication. And we need to monitor the progress and the effectiveness of your treatment by taking your finger 6 level so we know how effective it is if we need to change the treatment. Are you taking your medication?
Sometimes.
It seems to me like you do not understand.
But when we do the tummy talk, it'll go down.
It puts you at risk for insulin resistance. You want to have the breast is full of fat. You want to have extra Botox, is all fat. And your abdominal guard is above normal level. You have abdominal obesity. It's all fat. And insulin resistance we're talking about. This is all fat. The big stomach is fat, the big breast is fat, and the buttock is all fat. So we have to get your levels optimal. And I will need your help. I need you to be compliant. Now, I want to talk to you about the complications of diabetes because you don't understand, I'm afraid. You don't take medications only when you don't feel well. You take them even when you feel well. Now, diabetes can damage your eyesight. That sight damages can lead to blindness. It's called diabetic retinopathy. Diabetes can also damage your nerves. That's why you see sometimes people come in, they have foot ulcers, they have a diabetic ulcer that is not healing. That's a complication of diabetes. You can also suffer chronic kidney failure. Your kidneys can shut down if you don't comply with your treatment. And I can go on and on and on. The complications of diabetes are enormous, including the damage it does to your coronary artery system. So I will need you to make personal changes to your life.
Okay, I love you, doctor.
I want to see you in a few 6 weeks, and I'm hoping that you come for your appointment. I also would like you to take your blood glucose because at this point I don't know if the medication is effective, if it's not effective, if there are any changes, if we need to titrate the medications. So please, moving forward, kindly adhere to your, partner with us. Adhere to the medication regimen and our patient-centered plan. I will see you in 6 weeks.
And so, Dr. Wise, the patient is insisting that low blood glucose level is directly due to her husband's emergency. And since morning, I'm not seeing her, having a drive for food, like always. I tried really hard to convince her, and it was hard to convince her that the etiology of her disease is more than what she thinks, more than that. Mrs. Nduka hasn't shown up for any medical checkup, any medical appointment, nothing. I don't know what's going on. Good trust. Dr. Wise, are you listening?
Yeah, I am.
You look lost. Is everything okay?
Well, I'm thinking about my encounter with the patient. She was here a couple days ago, and I did ask her to keep a diary of her pre-prandial and post-prandial glucose, bedtime glucose levels. She said she had it, and she came. Oh, could you believe what she did? She brought out the record of her desire to do BBL.
That is not true.
BBA, BBT, she's just so preoccupied about having large Ikebe super, having it's just, there's a complete disconnect. She does not understand the diagnosis, the prognosis, and what non-compliance can do to her.
That's interesting. So, but I don't understand. She's moved on with her life. She's moved on with her career. Why are you so worried about her? What is so special about her that you get worried?
Well, I save people. I want my patients to get better. So it does bother me when my patients get better. But it all started with her husband. Now her husband is doing all fine. We were able to save his life. And he's compliant, he's okay, he's now up and running. But she is completely disconnected. She does not really believe in her diagnosis. She feels that she's fine, she doesn't take her medication. Her labs are very disturbing. Her GFR is significantly low, kidneys are failing. A lot of her systems are affected, and she does not understand. She's only thinking about BBL, having large groups, and what has been most?
No.
How can such an educated lady be so ignorant about her health? She's neglecting her health, and I would say that she's in denial.
That's sad to hear, though. That's why we need more access to good healthcare in our country.
Agreed.
And I had an idea.
You have an idea?
Yes. We should launch a campaign where we educate people about how to manage your sugar blood level, how to regularly go to see a physician or like a medical professional to get checkups regularly, and most essentially, to educate them on your lifestyle. Because the better you live, the less issues you have. That's what I believe.
Well, I agree. Creating awareness about diabetes mellitus is essential. You see, in Africa, a lot of people walk around undiagnosed with diabetes or undertreated diabetes. So the need for healthcare awareness is there. Now we have the mortality rates, our morbidity rates when it comes to diabetes is very high. So creating an awareness and educating people on the diagnosis and how to take care of it and preventing complication, is very important. So, go ahead, set up the campaign, and I look forward to, joining forces to make it happen.
All right, that's good to know. See, let me tell you. So the doctor, and she bring me medical etiology which I'm telling you, Ikebe super is the huge. See, let me tell you something. Do you know the flower was Niash? Ikebe super.
This is dangerous.
You see the dangerous. Hey, what? You see that? Hey, she's just paying those medical terms, no?
Yeah.
She never
told me she was going to give you to me.
like, say you. Put down.
Hey, can you imagine? Like this. Yeah, that's the still. That's the stick. I should have gotten one. Let's put that right here. Hey.
No, put this way. Let me see you.
Like this.
No, wait. Let me even move this your chair. Move this way.
What do you think? Is the shape shaping here?
Come this way, sir.
But just step in like this.
Wait.
Is there? See. Hi. But I need to go do my appointment now.
Ikebe super.
I should ask for her number. Is she gone? She gone.
You didn't ask me. I don't know. I don't know. Should they go do BBS? Come this way, master. What are you doing?
What? Try understand. Just see.
You got. Put down. Let me see. Might help you.
One here.
Like that woman. You are starting to look like something. This one, you look something. You look like you eat enough.
Extra to the front.
Right side one. Let me put down. Put down fine.
Extra to the middle.
Forget about this.
Don't worry.
Yeah, don't worry about that.
I'm trying to do stimulation.
I'm telling you.
Simulation to see how perfect it would be. What do you think?
Move it to the left, to the right.
And then
Wonderful.
And then extra to the left. One more.
No, this side.
Yeah?
Yeah, put that.
Yeah? What do you think? 17, 18, 19,
Where you go?
17, 18, 19.
See?
1, 2, 3, 4.
You see?
5, 6, 3, 4.
I'm telling you.
Go back up.
Go down. You see? You'll be dancing everything, I'm telling you.
Every guy will be looking at it. Hey!
See?
17, 18.
You see when you go to Jamaica? You go to the Bahamas. Hey, you see? You can read in my mind. You see? You'll be dancing this crazy dance. Sometimes don't stand even on table like this. Right? Dance. You see? You don't know that? You don't know. You don't know. They play. My sister. BB, you know, Ikebe is super. See, when you pump it like that.
I'll tell them. They will shake it.
No, if you add too much, you go burst now. Chill. Yeah, but you know that size. When you also, you will feel.
So just
you feel
a little natural, but a little natural.
You have,
but a little what? Extra.
Yes. So, welcome to my office, and how can I help you today? How are you feeling?
I've been having prolonged fever, headaches, nausea, abdominal pains. Sometimes I'm constipated and I have diarrhea. I've been taking my medicine, but it doesn't seem to be working.
Okay, I see. So, tell me, what's your name?
Wisdom.
Wisdom. Okay, nice to meet you, Wisdom. So, Wisdom, tell me, have you been compliant with your diabetic treatment?
All the time.
Interesting. So, we'll run some labs and some clinical investigations, and then we'll go from there. So, I'll see you in a bit.
Okay.
Hi, welcome back to my office, Wisdom, right? Okay, so I have your result with me. So from what I can see, okay, so you have a typhoid fever, right? And I'll recommend you to continue taking your diabetic medication in the meantime. And from the other things I see here, so your glucose, your blood pressure, and your cholesterol level are all good, which is a good thing. So, so I'll prescribe some medication to you. Make sure you take them properly, and then I'll see you in 2 weeks' time.
Thank you, doctor.
All right, you're welcome. Have a good day.
You want to snatch my boss? You want to snatch my boss? Stupid, useless people here! You want to snatch my boss? Who is here? They want to snatch
want to snatch my boss? You want to snatch my boss? You want to snatch my boss? You want to snatch my boss?
This is called
You want to snatch my boss? Stupid people! Foolish, stupid people! You want to snatch my boss?
Let's not waste our time. Come on, let's have to save her.
You want to snatch my boss? Hey, you want to snatch my boss? Leave me! You want to snatch my boss? Leave me alone! Stupid business people! Leave me alone!
Type 2 diabetes is the most common form of diabetes affecting millions of people worldwide. It's a chronic condition characterized by the body's inability to use insulin effectively, known as insulin resistance, and eventually the pancreas' inability to produce sufficient insulin, and it is often associated with lifestyle factors such as obesity, physical inactivity, and poor diet. Diabetes is the most important risk factor and is considered a coronary artery disease equivalent. This is because it places individuals at a similar risk for cardiovascular events as someone with established coronary artery disease. Certain ethnic groups, including African American, Africans, Hispanics, Native Americans, and Asian Americans, are at a higher risk for type 2 diabetes. Altered mental status in diabetic patients is often a medical emergency and can result from a variety of causes, most commonly related to blood glucose levels or complications like DKA, HHS, or infections. Prompt identification and treatment of the underlying cause are crucial to prevent long-term damage or death. Type 2 diabetes often develops slowly and the symptoms may be mild or absent at first. Common symptoms include increased thirst, urination, hunger, tiredness. A higher blood sugar can cause the length.
I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up. I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement.